Hello, I'm Dr. John McDougall, and I'm the Medical Director of the McDougall Program. Now, I take care of a lot of people, and almost every one of these people that I take care of is on supplements, vitamin supplements. They're taking A's and B's and C's and D's and E's and all kinds of supplements, believing somehow this is going to be a miracle to good health. Well, I asked these people, what's happened to you taking these supplements? Tell me about the positive benefits. Tell me why you're spending $100, $500, $1,000 a month on these supplements. Tell me about the weight loss. Tell me about the lower cholesterol. Tell me about the lower blood pressure. Tell me about how you feel better. You know, the response is almost always the same. I don't notice any difference. Well, why do you take them? Well, because I believe. I call this faith-based medicine. You have to believe because there's no evidence that it works. As a matter of fact, if you look at the scientific research on taking vitamin supplements, and I'm talking about isolated concentrated nutrients here. I'm not talking about herbal medicines. I'm talking about taking a fruit or vegetable and dragging out the beta-carotene or the vitamin C or the vitamin E or the various other vitamins like folate, and taking these isolated concentrated nutrients and multiply them tens of thousands of fold in concentrations and only having that particular nutrient present in the capsule. That's what I'm talking about. What happens when you take these isolated concentrated nutrients, you create nutritional imbalances. That's right. This high concentration of beta-carotene or folic acid or vitamin D goes into your intestinal tract, into your bloodstream, and then into your cells, where these high concentrations, they cause nutritional imbalances. You see, before a nutrient can work, that nutrient, be it a vitamin, has to go in the cell and has to attach to the cell. That's through a receptor. It attaches to the cell. Well, these receptors, they attach to a lot of different nutrients. When you flood the system with one particular nutrient like beta-carotene or folic acid or vitamin E, what happens is that high concentration, that nutrient, overwhelms and floods that receptor, and the other nutrients can't attach properly to the cells. And so you create nutritional imbalances. And that's why consistently, I mean, you won't find research otherwise. The large major studies done over the last 15 years show that if you take beta-carotene, you increase your risk of lung cancer. If you take other antioxidant vitamins, beta-carotene, vitamin E, what you find is you increase your risk of cancer in general, heart disease, and overall death. Vitamin E has been implicated many times over in increasing problems of heart disease. We used to use these antioxidants, these folic acids, these vitamin E's, as a panacea for heart patients. We cause them terrible harm. We increase their risk of dying and getting heart disease and cancer. So what do? Well, it's very simple. What you do is you don't eat isolated, concentrated nutrients. You eat them in their original packages, like the banana or the potato, so that they're properly mixed. You've got some beta-carotene and vitamin C and vitamin E and phytonutrients and fibers and phytates and so on, all in this perfect architecture that looks like a banana or an orange or a potato or a rice grain. These perfect packages designed by nature to work properly in the body when you eat them so that they go into the cells and they're in the proper proportions. No overbalance, no underbalance. And as a result, the cells work properly, and then you get all your vitamins and minerals, basically with no additional costs. And you get the good health that goes with these, taking them in these packages. It's very simple, but it should be logical and easy for you to understand. So you'll stop wasting your money on vitamin supplements. I'm Dr. John McDougall. Thanks for listening.